So what does the science say? What do we know about the mechanisms of action, and what does the preclinical literature tell us about the maintenance of weight and appetite stimulation? So I already mentioned in the last lecture that we know that the effects of THC in cannabis are mediated through the CB1 receptor, and both central and peripheral activators of CB1 can be effective at stimulating appetite and maintaining weight. And I also already mentioned that both cannabinol and cannabigerol are also effective at increasing weight, and specifically in the setting of chemotherapy-induced weight loss, CBG has been recently shown to be active at increasing food take and attenuating, so reducing that weight loss associated with chemotherapy. So looking at the future, what's registered in this area, what work is ongoing in the area of chemotherapy-induced nausea, vomiting, and cachexia. There are several trials looking at different types of compounds and in different delivery mechanisms. So there's a trial that's looking at inhaled synthetic THC-CBD combination for physical functioning and modulating cachexia progression in patients with advanced cancer. And this is a study being carried out by Tetra Biopharma with 334 patients. So this is a reasonably sized study and should give a significant amount of evidence about the use of inhaled cannabinoids at modulating daily function and body weight. There's also a peripherally restricted CB1 agonist being pursued by Artello Biosciences, and they've just had ethical approval to look at this peripherally restricted compound in cancer anorexia. As I mentioned in the last lecture, this means that this compound will activate the CB1 receptors in the body in areas such as the gut and liver, and in our adipose tissue, in our fat tissue, but won't cross into the brain as much as THC would, so it should have a more tolerable side effect profile if you are not THC tolerant. And there's also a tablet that's being pursued by Tilray, which is a THC-CBD combination that's being pursued specifically in chemotherapy-induced nausea and vomiting. So this is still an area of active research, kind of building on what we already know, and looking to see whether or not maybe THC-CBD combinations could be effective, or synthetic CB1 agonists that might have a more moderate side effect profile. So now looking at the kind of more psychological aspects of cancer and some of the areas in which we have an evidence base, but as I mentioned, this isn't where these endpoints have been measured as a primary endpoint, but where they've been measured as a secondary endpoint. So anxiety is something where we have good evidence that there is a use of cannabis-based medicines, particularly CBD medicines, in other anxiety disorders. And reductions in anxiety and stress and improved mood are frequently recorded as the reasons that cancer patients are using medicinal cannabis through survey data. And we do have quite a lot of data, at least with medical cannabis and THC, that anxiety, depression, and mood are all also significantly improved in clinical trials where they have been measured, usually as a secondary endpoint to pain or to nausea and appetite stimulation. But to date, this isn't something where it's been tested as the primary endpoint. And if you remember when I was talking about the drug discovery pipeline, you have to have a significant change in your primary endpoint for your trial to have been successful, and it's only those primary endpoints that then you can apply for approval for a medicine to be used for that indication. So given that we have quite a lot of this kind of secondary evidence that cannabis-based medicines are very beneficial for quality of life measures, there is quite a lot of ongoing research that is investigating this now as a primary endpoint instead of just as a secondary finding. So some of the registered trials that are ongoing and looking at psychological parameters with cannabis-based medicines in cancer include a couple of trials with CBD. So one which is looking specifically at CBD for anxiety in patients with advanced breast cancer. So this will have been one of the studies I will have already mentioned when I talked about the evidence base for purified CBD or enriched CBD products in the treatment of anxiety. There's also another study looking at CBD for symptom burden. So this is just general improvements in the well-being of patients, and these are patients in palliative care with advanced cancer. There's also a study looking at THC for quality of life measures in advanced pancreatic cancer, and for a cannabis product, a whole plant cannabis product with multiple phytocannabinoids for cancer-related symptoms. So I think that when we're in the future, we may find that some of these products will emerge as licensed products for the treatment of quality of life measures in cancer patients. So what about the clinical data on sleep? So the clinical trials that have been carried out with the product Sativex actually often did record changes in sleep. And this is probably because through the multiple sclerosis data that was collected with Sativex, there was consistently an improvement in sleep that was observed with these patients. And so it was also investigated when looking at cancer patients. So these 5 trials are all trials where Sativex was being investigated for its ability to modulate pain in cancer, but where sleep was measured as a secondary endpoint. And you can see that 3 of these trials with large patient numbers. So the most recent trial was in 2008 with 397 patients, and Sativex was found to be statistically superior on quality of life measures, and specifically to show an improvement in sleep disruption in patients with cancer. And similarly, there was a study in 2012 with 360 patients that showed that patients who received the low and medium doses of Sativex recorded significant improvements in sleep. And then there was a smaller trial that also showed an improvement in sleep. So at least with Sativex, we have good secondary evidence that Sativex is effective at improving sleep in patients with cancer. Now, let's move on to talk about cancer-related pain. And we have mentioned this in the pain lecture, but I'm going to give you a little bit more detail on some of the studies that have been carried out and what we do and don't know. So there have been 3 trials that found Sativex was effective. So 3 positive trials, and this was out of a total of the 5 that I've just showed you. 3 positive trials that found that Sativex, in a total of 580 patients, was effective for reducing pain in patients with cancer. And in Canada, it is licensed as an adjunctive analgesic. So this is an add-on pain relieving therapy in adults who have advanced cancer. And the typical dosing is between 5 and 16 sprays per day, and generally sprays less than 10 sprays per day is very well tolerated with Sativex, with quite mild to moderate side effects. Because of this 1-to-1 ratio of THC to CBD, you don't tend to see a lot of the psychotropic side effects like hallucinations, memory impairments, altered time perception that you see with THC products. There have been a couple of trials with THC, so 2 were positive, but these were quite carried out quite a long time ago, and the more recent, larger study with THC was negative. And in general, THC was less well tolerated in these studies. Specifically, higher doses, 10 and 20 milligrams, were not well tolerated by patients, and they did discontinue their THC treatment. Although starting low and slow and increasing doses slowly over time may offset those side effects. And the studies that used lower doses of THC, such as 1 or 2 milligrams, were quite well tolerated. And the patients that this was carried out in in terms of the reductions in pain, they were all types of cancer patients. So this hasn't been specifically carried out in one particular type of cancer, but what was consistent among the patients was that they had chronic pain, either from chemotherapy or from cancer itself, and they were not receiving adequate pain relief on their opioid therapy. So they were refractory and not doing well on other forms of pain relief. And just something to say there is that these are obviously, suffering significant pain, and other medications aren't working. So it is a difficult population in which to manage pain anyway. So I think that trials where a cannabis-based medicine was tried earlier or in less refractory patients may have had a greater chance of seeing a positive outcome. And these were all adults, so we don't have any data on cancer-related pain in children, and they had an average age of 50 to 60. So the Sativex data, there was 5 trials with Sativex. So just kind of going in reverse chronological order, you can see that the first 3 trials in 2010, 2012, and 2013 were all positive in that Sativex in all of these trials was significantly able to reduce pain severity. However, the most recent trial, which was the largest trial in nearly 400 patients, Sativex was not superior to placebo. And I think this is the main reason why we don't have a kind of a broader licensing of Sativex in cancer pain, was based on those the most recent negative findings, because up until then the story was looking very good with Sativex, and I think that the company were probably quite hopeful that Sativex would get licensed for use in cancer-related pain. And then the trials that have just looked at THC, and I just wanted to point out here that we don't have any other trials looking at other types of products. So we don't have cannabis whole plant extracts. We don't have any clinical trial data with that in cancer-related pain. So the randomized controlled data with THC, there were 2 quite older studies in 1975 that did show a positive effect of THC in patients with cancer-related pain, although quite small patient numbers, you can see, and at high doses THC wasn't well tolerated in these studies. But the most recent study that was done with Nabla and published in 2006 did not find a significant impact of THC. And this is a reasonably small dose of THC, I think, so up to 2 milligrams per day is probably quite a small amount of THC. So it was well tolerated because it was quite a low dose, but it wasn't significant in treating either pain or sleep or nausea in these patients. And I mentioned this in the pain lecture, but I wanted to bring it up again in that this is data specifically in cancer patients with pain, where they recorded that it's not their pain severity that has improved with their medicinal cannabis, but it is in their ability to cope with pain that we saw significant changes in the ratings reported by patients. So cannabis may affect coping and distraction from pain better than pain relief itself. So like the chemotherapy-induced nausea and appetite suppression, this is still quite an active area of research, and there are several trials ongoing looking at various cannabis-based products and its ability to reduce cancer pain. So there's a vaporized THC CBD product, which is a 3-to-1 ratio from Tetra Biopharma, where the primary endpoint is pain intensity in cancer patients. There's a whole plant oil capsule, which is again looking at a pain rating as its primary endpoint. There is a CBD paste product looking at peripheral neuropathy induced by chemotherapy, looking at change, and again it's a pain rating that they're looking at changes in pressure cessation and whether that's altered by CBD. And there is a pure THC, a dronabinol, being investigated for the need for opioid pain medication. So this study is looking at whether or not THC can reduce the amount of opioids that is required in breast cancer patients suffering from pain. So this is still an active area of research, and so we're still gathering data and looking at other types of products, because the best data, really most of the evidence that we have so far, is based on THC, but you can see now we're getting some data with CBD and also THC CBD ratios. So I mentioned at the beginning that cannabis-based medicines aren't just used by adult cancer sufferers. There's quite a large use of cannabis in pediatric cancer, so in children with cancer. It's quite reasonably prevalent in the treatment of symptoms related with cancer, but also looking for a cure for cancer. And it's often turned to when all else has failed. And when you look at the internet, you will see stories where there seems to have been a remarkable recovery of patients with cancer when they started using cannabis-based medicines. There's some information out there, some data that you can look at, some observational data which has looked at the use of cannabis-based medicines in pediatric cancer. A survey in America found that the most common reason that children with cancer use cannabis, similar that we see in adults, but it's for the management of nausea, pain, and loss of appetite. So same reasons that adults use it. A survey in Israel looking at children and their parents found that there was a positive effects of cannabis reported by children and their parents in 80% of cases, and nearly all of those surveys found that cannabis was helpful at alleviating both the physical and the psychological burden of the disease. There have been some studies that have investigated THC products in the treatment of chemotherapy-induced nausea and vomiting, and they're available in this publication if you want to read any further on this. So they are studies that have shown a benefit of THC products in this setting, as has been observed for adults, although the THC is not licensed for children for this reason. And unfortunately, when you look at websites like clinicaltrials.gov, you'll see that there's actually no current active research in children. So despite the fact that many parents are using cannabis, finding it beneficial, and some even quite miraculous evidence of cannabis-based medicines potentially being curative in some childhood cancers, there is no current research that is currently investigating this from a clinical point of view. So if we summarize some of this data and look at the cannabis treatments that have best evidence and some evidence, we can say that in chemotherapy-induced nausea and vomiting, the best evidence that we have is with THC. An awful lot of trials, 40 trials have been done in this area at least, showing that THC is beneficial for this indication. There's also some evidence that cannabis, whole plant cannabis use or Sativex can be useful for this indication as well. With appetite stimulation, we've got moderate evidence that cannabis-based that THC is effective at treating this, and we don't really have much clinical evidence of other products being beneficial here. In terms of cancer-related pain, the best evidence that we have is with Sativex. Again, it's just the product that has been most well investigated and studied, with 5 clinical trials, 3 of which were positive for Sativex. So our best evidence is with a 1-to-1 ratio, which, if you remember back to the initial data I talked about in terms of what do patients prefer, it was actually the balanced 1-to-1 cannabis products that people are tending to use anyway. So I think anecdote tells us that there's something behind this, that a balanced 1-to-1 product seems to be the best for pain relief and relief of other symptoms as well. And in terms of sleep, although it's secondary evidence to the effects on pain, there is good evidence that cancer patients with pain who use Sativex also see significant improvements in their sleep. So if we try and dissect this all out and look at the hierarchy of evidence, you can see that top of the triangle, it shouldn't be a surprise, comes THC for chemotherapy-induced nausea and vomiting and appetite stimulation, multiple clinical trials, systematic reviews and meta-analysis of the multiple trials that we have for THC in this area. Then probably next comes Sativex for pain, with the caveat that some of the trials were not successful, although I think that many of them were, and so it's probably something that does have an evidence base, and I'm sure there's probably reasons why that latest trial didn't succeed. And if we think about our primary endpoints, and are we using the best primary endpoints in these trials for measuring the effectiveness of these medicines, we could say that maybe pain ratings are not the best way to judge medicines like Sativex, and actually we should be thinking of different ways of recording their effectiveness. Sativex or cannabis for chemotherapy-induced nausea and vomiting is probably at the lower of the randomized controlled trial segment of the triangle, followed by THC alone for pain, which is actually really an area that needs a lot more research, at least in cancer-related pain. And then we've got all cannabis-based products like pure THC, pure CBD, Sativex or whole plant products, which all have an amount of evidence, both anecdote and secondary evidence, for the reduction in anxiety and depression, and improvements in mood and improvements in sleep. So that's where we're at with the hierarchy of evidence, but the good news is this is something that's still being researched. There's still an awful lot of active research in this area and trying to figure out which products are best for which symptoms. So to summarize, there is widespread use of cannabis by patients, adults and children, for symptom relief. And our clinical trial data does support the use of THC for nausea and appetite stimulation, and in my opinion does support the use of Sativex for cancer-related pain and sleep improvements and quality of life improvements. And this continues to be an active area of research, with multiple products by multiple delivery routes being tested for different symptoms, in terms of more work in psychological aspects of cancer, more work in pain, and more work in appetite stimulation and chemotherapy-induced nausea and vomiting. I think that also the palliative end-of-life use of cannabis is something that we may see changes in policies, with maybe some governments becoming more relaxed about end-of-life care and when cannabis-based medicines could be used in that regard.